Hello everyone, welcome to the Nursing Students channel on YouTube. Here we talk about everything nursing from academic to our researches and every other thing concerning nursing. If you're a new member, kindly hit the subscribe button and then hit the notification bell so that you get every new video that we do. And if you're an old member too, then you are welcome. Enjoy the class. Our topic for discussion today is introduction to the nursing diagnosis. Let's get on it. Okay, so to begin with, we are defining nursing diagnosis, and the definition is that it is a clinical judgment concerning human response to health conditions, life processes, or a vulnerability for that response, which is the response to health conditions, okay, by an individual, family, group, or community. So the nursing diagnosis basically is how your body responds to something that happens, and that thing can be a medical condition, or it can even be a life process or a vulnerability. A life process like aging, like pregnancy, okay, and then vulnerability includes amputations and physical injuries, and all those things are also vulnerabilities. And when we look at the nursing diagnosis, it is actually the second step in the nursing process. And the nursing process it's a 5-step approach to solving clinical issues, okay, normally applied by nurses. The first step is the assessment, which involves finding the problem or searching for causes of the problem. The second one is the diagnosis, which is what we are about to treat. The third one is planning, which involves setting goals and then setting aims and then working towards them, which is implementation. And then the last one is evaluation, which is checking whether the goals that you set and the implementation that you put in were successful or unsuccessful. So the purposes of the nursing diagnosis are basically one, to help identify nursing priorities and thereby help direct nursing interventions. So when we know our priorities, when we know what we are supposed to do for the patient, which is first, which comes second, which comes third, which is more important, it helps us to also plan our task well. Okay, because when a patient comes to the hospital, a patient with breathing difficulty is supposed to be catered for first before a patient that has a small cut. So the nursing diagnosis will help you to know which is more important and which is more at risk or is more deadly to the patient. And then the second one is it helps identify actual or potential health problems and life problems too. And then it also helps with the available strength to prevent or resolve those problems. So the nursing diagnosis, apart from helping you to identify the problems the patient have or the life processes and then the vulnerabilities the patient has, will also help you to identify the strength of the patient in helping to solve or prevent those problems. Okay, so normally we use the patient's strength to help in actually solving the problem or preventing it. What can the patient do for themselves? What is the patient capable of doing in helping to prevent or solve that problem? And the third one is the nursing diagnosis helps in the formation of expected outcomes. Yes, when you are able to plan ahead well for the patient, you are also able to plan what is expected at the end of implementing that problem, and that is where evaluation comes in. So at the end of every other thing, at the end of the nursing process, you have to evaluate everything that you've done based on the goals that you have set. So if the goal was achieved, then you are successful. If the goal wasn't achieved, then you have to re-amend the plan that you put in and everything, and then also come back again with another planning. And the fourth one is it provides a common language of communication between nursing professionals and the healthcare team. Yes, the nursing diagnosis is the common language that every other nurse is expected to understand worldwide. Okay, and then the medical team too can also, based on the nursing diagnosis that you give, understand what you're trying to say. The lab technician and any other person in the healthcare team is capable of understanding what you say using the nursing diagnosis. And the last purpose is it provides a basis for evaluation of nursing care. Yes, so after your nursing diagnosis, you are able to know what you are looking for in the evaluation. Okay, you don't just go about evaluating it without having any set goals or aims. So based on the nursing diagnosis that you make, your evaluation is also planned ahead. Okay, so that at the end of the goal, at the end of the implementation, you can know whether the goal was achieved or the goal wasn't achieved. So then what is the difference between a nursing diagnosis and a medical diagnosis? Basically, the main difference between the nursing diagnosis and the medical diagnosis is just that the nursing diagnosis is directed towards the patient or the individual and his or her physiological and psychological response. So the nursing diagnosis focuses more on the patient than the patient's problem or the patient's condition. Okay, but then the medical diagnosis focuses on the disease or the medical condition. That is why in making your nursing diagnosis, you are not allowed to use medical conditions for your problems. For example, you can't say that the patient has malaria related to something, or the patient has let's say general malaise related to malaria. You can't say that, okay, because it is not your duty to do that. That is for the medical doctor to do so. So your nursing diagnosis is only focused on helping the patient deal with his or her immediate problems, and that is like you are treating the symptoms of the patient. You are not treating the condition of the patient. You focus on treating the symptoms of the patient, and those symptoms can be actual symptoms, it can be risk symptoms, potential symptoms. You get it? It can even be the patient's response to the condition or the patient's response to the condition symptoms. That's that. An example is anxiety or insomnia. Those are symptoms that you as a nurse, your nursing diagnosis is focused on. But then the medical diagnosis by the medical doctor is focused on finding what is causing the patient's symptoms. So the patient is complaining of headache, malaise, loss of appetite, what else? That is your duty as a nurse to tackle those immediate symptoms, the general malaise, the headache, the loss of appetite. But then the doctor's main purpose, the doctor's main work in making the medical diagnosis is to find out what is causing the general malaise, the headache, the loss of appetite, and that is the malaria. So the doctors deal with the condition, that is the malaria condition, but then they don't focus much on the symptoms. That is your duty as a nurse to do that. So you as the nurse is supposed to know what to do for the patient when the patient has a symptom or that symptom. Okay, so that's the main difference between the medical diagnosis and the nursing diagnosis. Whereas the medical diagnosis focuses on the condition, the nursing diagnosis focuses on the symptoms of the condition, and that is what the patient is going through. So actually more like focusing on the patient. Okay, yes, that's the main difference between medical diagnosis and nursing diagnosis. The other diagnosis too, like collaborative diagnosis, where both it tackles situations from all angles for the patient and then for the nurse and then the doctor also and other medical healthcare team. Basically, nurses use generalized worldwide language in making their nursing diagnosis, and that is termed as the NANDA-I, which means the North American Nursing Diagnosis Association International. That is the language that the nurses use in making their nursing diagnosis. There are so many nursing diagnoses that NANDA-I has accredited to be used. And so you might have a nursing diagnosis, but then if it is not accredited by NANDA-I, it is wrong. That is academically wrong. Okay, so NANDA-I has a set of nursing diagnoses that it has approved for use. There are so many books that has all those things. I will put a link of one site that you can get all those nursing diagnosis approved by NANDA-I. And our nursing diagnosis is classified under the taxonomy 2. Okay. Right, that brings us to the end of today's lesson. I hope you learned something. I hope you've got something. I hope you've understood something. Let's meet same time tomorrow. Let's continue exactly from where we ended. Stay safe, have a nice life, and keep learning.